We're talking today about birth control. If you have questions, you can send them to the doctors at WLBT.com. Joining us is Dr. Holt Crews, an OBGYN with Baptist for Women. Thank you so much for joining us. Tell us, how has birth control changed in the past, what, 10, 15 years?
Really more options. You know, the basis of most birth control, and when we're talking about birth control, I mean, there are lots of different options, but hormonal birth control is kind of the most common, with birth control pills being the most common form of hormonal birth control. But really the biggest change has just been in widening some of the options of the pills, having more low-dose options, the delivery system with the vaginal ring or the patches, and then also some of the delivery of some of the progestin-only hormonal.
Are those patches safer than taking a pill?
No, the patch, there's been some controversy in the past, and it's some sketchy information about the patch, but they're not really safer or necessarily more dangerous. You're still getting estrogen and progesterone. It's just in a different delivery system. The vaginal ring is probably more common now, and it's also a sustained delivery as opposed to taking a pill every day.
So there isn't just necessarily the oral meds anymore.
Right. Those three, the patch, the vaginal ring, and the oral birth control are all combination hormonal systems. In other words, you're getting both estrogen and progesterone. With the exception of a few oral medications, you get a combination, and so you still have the benefits and the potential risk of both the estrogen and the progesterone.
Dr. Crews, one thing they have now is they have extended pill use, so that you don't have a period, but what, once every 3 months, or is it,
right? Is
that standard?
That's the standard for extended pill now, is once every 3 months.
That seems so not normal. I mean, does it mess up your fertility?
Well, I'm wanting to know if it makes you mean.
It might.
Because, you know, as females, that's what they say, is that, you know, you get kind of mean when you don't have one, or if you're being late. So I'm wondering, does it really mess you up emotionally?
Most people do very, very well on it, and again, it's because you have to realize when you're taking a pill, you're getting estrogen and progesterone at a given dose on a daily basis, which your body, if you were not to have a cycle, if you were to skip cycles, it's usually, and you're not on anything, it's usually a sign that you're not ovulating, and that's where the hormonal balance is a little bit off. But when you're on a pill, you're getting both the estrogen and progesterone on a daily basis, so it's really like you're during the first couple of weeks for that whole time, and it's actually a safe way to do it. A lot of people love it. A lot of people don't like it because they feel it's just not natural.
But it won't affect your fertility.
It won't affect your fertility, and you know, but I do throw in if you're doing that on your own, if your body's doing that on your own, you need to talk to your doctor, because that's a sign you're not ovulating. But it's okay to do that if you're on a pill.
All right, Dr. Crews, thank you so much for joining us from Baptist for Women. Thank you so much. And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.